Mr. President, more deaths in 2020 than in any year in over a decade. That's what the Chicago Sun-Times headline read last week. But this wasn't a story about the coronavirus. It was an article about suicide. There were more suicides by Black residents of Cook County, Illinois in 2020 than over the past 10 years. All told, 437 of our neighbors in Cook County took their lives. At the same time, more than 700 Cook County residents died from opioid overdoses between January and June 2020 alone, double the number from a year earlier. While the human suffering of COVID-19 has captured our attention, as it should, two other deadly epidemics in America still rage on: opioids and the mental health crises. Even before the virus took its toll, we had been in the midst of the worst drug overdose crisis in our nation's history, and we were witnessing skyrocketing rates of suicide. But COVID-19 has deepened these epidemics, which sadly feed on isolation and despair. With the convergence of coronavirus emergencies, we are failing those most vulnerable to addiction and mental health challenges. And like the coronavirus, mental health challenges and addiction can occur with any one of us, in any family, in any neighborhood. Earlier this month, the New York Times profiled 3 American mothers on the brink of chaos and crisis. The story chronicled the relentless stress and burdens of working mothers over 11 months of this panic, struggling to balance remote learning duties for their kids, keeping their families safe and healthy, keeping food on the table, paying the bills, and knowing that every morning they have to get up and do it all over again, that day and the next day, with no end in sight. One of the mothers described the struggle this way. She said, "We are holding together with the same tape that we've been using since March. The tape's barely working, but we're still here." She speaks for millions of mothers. Experts and advocates warn that COVID-19 has created a perfect storm for surge in mental health and addiction, isolation, fear, grief, financial hardship, all come together and can feel overwhelming. At the same time, the pandemic has made it more difficult for many to connect with life-saving care and social services. Peer recovery meetings have moved to Zoom. Routine human connections have been lost. Treatment access restricted. It's trauma on the brain and body, and it fuels the alarming spikes in addiction, overdose, and suicide. Last week, I spoke with advocates from the Illinois Society of Addiction Medicine and a group called Live for Lolly, a community organization focusing on recovery and harm reduction. These community leaders provide life-saving care through recovery programs, street medicine, handing out fentanyl test strips, and distributing the overdose reversal drug, naloxone. The statistics they shared with me on Chicago area opioid overdose deaths during this pandemic are devastating. In the last year, opioid deaths have soared 23% in Lake County, 37% in DuPage County, and a staggering 64% in McHenry County. Every morning we look at the posting on CNN on the deaths in America from the coronavirus. Heartbreaking, over 500,000 people dead. But we're not posting the increase in deaths from opioids during the same periods of time. Addiction is an equal opportunity killer. But like COVID, the opioid epidemic strikes communities of color with a disproportionate ferocity. In Chicago, Black residents are dying from overdoses at 7 times the rate of white residents. Let me tell you about one person who sought help from Live for Lolly, a woman named Tanya, who recently moved to Lake County. When the pandemic hit, the recovery meetings for her substance use disorder shifted to Zoom, and the weight of the challenge led Tanya to struggle. She knew her recovery was in danger. For days, she called for treatment programs, but no beds were available. Desperate, she called 911 for emergency care at a hospital. Tanya was evaluated and sent home. Feeling hopeless and ashamed, she decided to take all the pills in her mother's bottle of blood thinner medication. She was taken unconscious back to the hospital and pronounced dead. Too many like Tanya are being left alone at their darkest hours. And it's not just in the Chicagoland area. According to the CDC, emergency room visits for suicides and overdoses have spiked nationally once the pandemic gripped our nation. By May, the country had experienced its largest one-month spike in overdose deaths. A new survey conducted by the CDC also found that 1 in 4 young adults had considered suicide in the past month. 1 in 4. This should set off alarm bells in every direction. There's no vaccine against despair and addiction, but there are programs and treatments and strategies. We must give communities and healthcare providers the support they need, now more than ever. The American Rescue Plan proposed by President Biden provides those resources. The House is expected to vote on the president's plan this week. The Senate has to show the same sense of commitment and urgency. The American Rescue Plan includes nearly $4 billion in addiction and mental health treatments for healthcare providers. It has $7.6 billion for community health centers to address behavioral health disparities. It includes a plan that I crafted with Senator Rubio to increase the availability of health care, including behavioral health treatment, by providing scholarship and loan repayment awards to build the pipeline of health professionals who agree to serve in needy areas. Special efforts will be made to recruit more people of color into these healing professions, which can help tackle disparities. The President's Rescue Plan also expands health insurance coverage through the Affordable Care Act and Medicaid. This money will save lives. America has arrived at the heartbreaking milestone, 500,000 COVID deaths. As we work to expand vaccinations and end COVID-19, we cannot ignore the lethal epidemics of addiction and suicide, which are soaring in the cold shadows of this pandemic. Every day we wait, more people in every zip code in America struggle. More families grieve. More lives are lost. We need to get help to the people who need it now. Mr. President, you and I are veterans of Congress. We've been doing this for a few years. Some things happen that give you hope. A year ago, we passed the CARES Act. It was nothing short of amazing, but we did it in a moment of real fear. We just saw this pandemic starting to rise. We saw businesses starting to close. We moved quickly, decisively, with the biggest spending bill in the history of the United States. More than $2 trillion for the CARES Act. And it passed this Senate in this hopelessly politically divided America by a vote of 96-0, the CARES Act. Well, it took us a while to come back with a reprise or an answer to what happened after it passed. The pandemic raged through America. The economy floundered. Millions were unemployed. And in December, just a few short weeks ago, we passed the second bill, the December relief bill, $900 billion, a sizable investment. And we characterize it as an emergency response, a special response, a temporary fix to go into the system and pay for unemployment benefits and many other things. $900 billion, substantial sum of money. And it passed here with 92 affirmative votes. 96 on the first, 92 on the second. Still amazing roll calls in a politically divided chamber like the United States Senate. Then came the new president. I won't put in all the other chapters that occurred. It seemed like an endless novel, but it was serious. But this president came in, President Biden came in, and faced the reality of what we have in America today. Last night he did it as well. He and the First Lady, as well as Vice President Harris and the First Gentleman, stood in silent prayer for the 500,000 Americans that we've lost. Not ignoring the problem, but facing the problem. President Biden said, "Come together, America, unite, And let's, with common purpose, address this pandemic and the problems it's created. It's a much different approach in his presidency. To me, it's honest, it's refreshing, it's hopeful. But he's turned to this Congress and asked this Congress to pass the American Rescue Plan. It's a measure that cost $1.9 trillion. It's huge. It has to be. Considering what we face in America, we need nothing less. Maybe we won't need to spend every penny. I hope we don't. But we better be prepared to pay for it if we are. Money for more vaccine and distribution of that vaccine. Money for cash payments to families that need a helping hand. Money for unemployment benefits that are supposed to run out in just 2 short weeks on March 14th. Money for rental assistance for people who are facing eviction. Money for schools so that they can prepare the classrooms for teachers and students to return safely. The list goes on, and it's an important and valuable list. And as I mentioned, money for mental health treatment and addiction treatment that is still a very real challenge in America today. The difference is this: in the CARES Act with 96-0, and in the December bill, which we passed with 92 affirmative votes, those were under the Trump administration, and there was a strong bipartisan support of that legislation, as you can tell from the numbers. The roll calls tell the story. Now comes President Biden asking for another rescue package for America, which is still languishing, fighting this pandemic. We don't hear the same calls for bipartisanship, or at least we don't hear the same responses to the calls for bipartisanship. Why? What's different? The only thing different is we have a different president. When it was a Republican president named Trump, Democrats like myself and virtually all others stood by and said, let's do it together. We can disagree on everything under the sun, but when it comes to this pandemic and what it's doing to America, we're going to stand together, both political parties. But when President Biden makes the same proposal, we don't hear the chorus of support from across the aisle that we once did. That's disheartening to me. The problems are real. Sure, there are ways any legislator could perhaps write the bill better, but let's get that done. And let's respond, as the president has called, with the resources that America needs to get back on its feet. That's where we are today. The House is going to pass their measure this week, and in the next couple weeks, the Senate will get its chance. It's time for us to stand up and do something. The American people didn't send us here to squabble or to find reasons for differences, but rather to come together in a bipartisan way and solve the problems facing this country. The president believes, and I share the belief, that a united America with the resources can conquer this challenge as it has so many in the past. We can do that, but we need to do it by coming together. Mr. President, I yield the floor and suggest the evidence of a quorum.